Ladies and gentlemen, friends and families, and health professionals. Today is 5th of August 2022. I am Dr. Mohammed Adil from United Kingdom. I am fellow of the Royal College of Surgeons and have 25 years of unblemished medical record with a lot of contribution towards teaching, training, and research, at least 30 years in UK. I always believe on my Hippocratic oath, which says, first, do no harm. I also believe on Nuremberg Code, which is against the atrocities of the Nazis for fatal and inhuman experiments on the public without their consent. And I also believe on Helsinki's declaration. When I raised all these concerns during early 2020, I was targeted and dismissed with suspension by the General Medical Council on 1st of June 2020 for the alleged 4 online complaints by anonymous members of the public due to my personal viewpoints of COVID-19 and its far-reaching effects on the public and the patient care and health system, which was not liked by the regulatory body. I had no clinical, ethical, probity, social, or health issue whatsoever. My suspension was further extended for another 12 months on 26th of May 2021 for pending GMC inquiry, and my case was referred on 14th of June 21 to the Medical Professional Tribunal for decision. So it took me 12 months to wait for the Medical Professional Tribunal hearing, which took place last month from 13th of June 2022 until 1st of July 2022 in Manchester. During the trial, GMC failed to produce those 4 anonymous complainants who had lodged online complaints against me regarding my viewpoints of COVID-19 on the social media. Number 2, GMC failed to produce those medical directors, Dr. Jonathan Moise, medical director of the North Manchester Hospital, who dismissed me due to my viewpoint on COVID-19 on 22nd of April 2020 without any charge sheet, notification, or disciplinary procedure. It was totally unlawful and unfair dismissal. And GMC failed to produce another medical director, Dr. Neil Hepburn, medical director of the United Lincolnshire Hospital Trust, who was also involved in dismissing me on 7th of May 2020 because of my primary video on which I was dismissed in North Manchester Hospital when I went to do locum in Pilgrim Hospital, Boston. And he also did not follow the disciplinary procedure before dismissing me, but wrote to the GMC that he had no clinical concern whatsoever related to Mr. Adil's performance. GMC also failed to produce any proof, evidence, or any witness or survey to confirm that my videos on the social media regarding my viewpoint of COVID-19 have caused any harm to my patients, safety of the public, or brought disrepute to my profession. On these grounds, the medical professional tribunal should have dismissed and squashed the GMC case altogether and should have reinstated me. But unfortunately, the medical professional tribunal, which is a part of the GMC, pretends to be independent, but they are not independent.